So welcome everyone to the December 2022 Brunch and Learn with Community Action. I'm Liz Jennings and I'm Director of Community Engagement with Community Action of Skagit County. And this month's topic, we're really excited about it, is services for seniors and adults with disabilities. And just to give you a little bit of an idea of what these sessions are about, back in the before times, before the pandemic, we would have a lunchtime once a month get together called Lunch and Learns, where we would talk about a big community need, a broad issue. Then we would talk about what the community is doing to organize around that. And then we focus in on community actions, programs, and services, and what our folks are doing on that issue. So we started it up again, and we call it Brunch and Learn because 9 a.m. was more convenient for most people. I've got my brunch right here in coffee form. I hope you have a snack or something with you. And feel free, if you would like to introduce yourselves, please write your name and organization in the chat. If you'd like to get on any future mailing lists or connect with others in this group, include your email address or other contact information. So this year at our Brunch and Learns with Community Action, we've talked about housing and homelessness, street outreach with people who do not have homes. We've looked at our East County services, the wide array of services and community capacity building that Community Action does in the food and emergency food system, and many other things. And we're going to keep going with it in 2023. So do let us know in the chat or via email if you've got a curiosity about Community Action, something that you want to know more about, or you're not sure how it works at Community Action, throw it in the chat and we'll see if we can address it at a future Brunch and Learn. So today we are going to be talking about our Senior and Disabled Volunteer Services Program, Medicaid transportation, and senior food assistance through a program called Community Supported Food Program. So I would like to introduce the staff who are going to chat with us today. First, I'm going to do a shout out to Josh for helping with the technology and Isabella for helping with notes and facilitation. So I would like to introduce Mariana Brandt, and please introduce yourself and your role with Community Action.
Hi, everyone. It's great to be here and see a lot of familiar faces. So my name is Mariana, and I am the Senior Disabled Volunteer Services Program Coordinator at Community Action.
Thank you. And Nikki Robinson, introduce yourself.
Hi, my name is Nikki Robinson. I am the Medicaid Transport Coordinator here at Community Action.
And Lori Bergerstock.
Hi, I'm Lori Bergerstock, and I'm at the Food Distribution Center in Cedar Woolley.
Thank you. And Sandy York.
Hi, I'm Sandy York. I'm Division Director at Community Action, and Senior and Disabled Volunteer Services and Medicaid Transportation have been under my supervision for the last year, but we have just hired a new division director and we're doing some shifting around. And so I'd like to introduce Yvonne Reinierson, who will be taking on direction of these programs shortly. So Yvonne, would you like to introduce yourself?
Hi, thanks, Sandy. I'm Yvonne Reinierson, and I'm very excited to be a part of this organization. So thanks for having me.
And we're so happy to have her. We have one other special guest, and I'm not sure if he's joined us yet. Robert McCracken, I don't see your name on the list. Have you joined the call yet? If not, we'll come back and introduce you in a little while. So thank you everyone for those introductions. So I'm going to do just a very brief introduction of Community Action. For those who do not know, we're very excited, and thanks to Isabella and her leadership, we have a new website for Community Action of Skagit County. And this is where we like to direct our own staff, our partners, volunteers, community members, and the folks we serve as the first place to go for information. So for today's topic, I'll show you there's two ways to get to these programs. One is to go over to this I'm looking for. So this is usually more the kind of question that a potential client might have, like what is their need or their curiosity? And under that tab, there's many things that might benefit seniors, our food programs and links to partners at food banks and food pantries, information about urgent needs and transportation, help paying the bills, housing, veteran services, job skills, women, infant, and children, and yes, custodial grandparents have benefits that they can access even through WIC, energy assistance, and our East County services. We've grouped many of the services specifically for seniors and people with disabilities under this link. Again, there's transportation, yard work, minor home repair, moving assistance, paying bills, urgent needs, food, and housing assistance. You can also find these programs. The three folks who are going to speak with us most of today are Mariana, Nikki, and Lori. And if you go under the programs tab and click on that, you find all of Community Action's services by program name. And right down here, Senior and Disabled Services. Click on that. And it is slowly opening. There we go. And it has all three of these programs conveniently grouped together. So Senior and Disabled Volunteer Services, Medicaid Transportation, and what we call the Food Box Program, Commodity Supplemental Food Program. I always get the acronym wrong. So that's CSFP, the Food Box Program. And we're going to hear more today about who is eligible, how to apply, and how to get more information. So let's start by talking about why are services for lower income seniors and adults with disabilities needed. So I took a peek at some of the community level data, and one thing that I learned that I didn't know before is that 24.2% of the Skagit population is over the age of 65. And you're going to hear these programs today may serve people younger than 65. Different programs define seniors in different ways. But that's actually really, it's something important for us as service providers to remember, because statewide, it's only 17.3%. So we do have a higher percentage of our population here in Skagit County who are seniors and who need those services. According to census data, 10% of the seniors in Skagit County are living in poverty. This is kind of an average over the last 5 years. There was a significant drop in 2021, and I'm curious about why that is, or if there's a problem with the data, but it's been holding steady somewhere between 9 and 12% for the last several years. So that's about 3,000 of our neighbors are living in poverty in their later years. 42% of the seniors we serve at Community Action, 42% are living at less than 30% of AMI, which is considered quite low income. So in Washington State, nearly 30% of the population are adults with disabilities. I'm sorry, that's people with disabilities. I don't have the number for adults specifically. But one thing that we do know is that adults with disabilities are 2 times more likely than the rest of us to live in poverty. 19.5%, nearly 20% of people with disabilities are living in poverty in Washington State. So I'm going to ask Mariana and Nikki to share a little bit more in terms of stories about their clients. But for 2022, in terms of the data, 70 seniors and disabled adults were served multiple times. we provided information and referral to closer to 1,000 folks who called in. So that really does show the need that seniors have, not just for community action services, but for services throughout the community. For our Medicaid transport program, they had helped transport 45 clients, and that's seniors, adults with disabilities, and other Medicaid patients. Many of them repeatedly, several times a month. So of those 45 folks, many of them are very dependent on Medicaid transportation to get their basic health care or chronic disease management met. So I do want to acknowledge the many partners who are on this call who also serve seniors that are experiencing poverty and adults with disabilities. Of course, a very important partner is Northwest Regional Council, which is our area agency on aging. Public health, Skagit County Public Health. We have resource specialists and some admin from Northwest Regional Council here. We have a medical social worker here and folks from Friendship House. One of the things we are hearing, Friendship House is one of our partners in homeless services, and we are seeing an increase of seniors experiencing homelessness in Skagit County, which tracks with high costs of living going up, cost of housing and low apartment availability. Unfortunately, it would be expected that those with the tightest incomes, the most restricted incomes, would be experiencing homelessness at increased rates. So thank you all to our partners and community action employees who are here, and volunteers and donors who are joining us today. I also see some current and former board members, so thank you for being here. So I'm going to start with Mariana. I can show your webpage, but why don't you, I'm going to ask you first about what your program can do, what services you have, but why don't you start with just a short example, like somebody who calls the phone number or emails you.
She's hogging the point now.
What is going on that an adult with a disability, a senior, or maybe one of their loved ones or an advocate or case manager might contact you?
Yeah, so we get referrals in many different ways. So either the client themselves reach out, or like you said, a loved one, a concerned neighbor, family member, or like a social worker or somebody from Northwest Regional Council can refer a client to us if they're concerned, see if maybe we can provide some direct services. But throughout our conversation with the client, we're able to see if they're eligible for direct services or if they're in need of any other services in our agency. So sometimes when a client calls for one specific thing, like throughout the conversation, we can figure out that they're actually having some other needs that are really important, like they're having difficulty paying their bills. Like you're mentioning, there is a pretty big housing crisis. So it's not uncommon that I hear seniors say that their rent has increased even like 50%. So it's being able to have those conversations, seeing where, even like what programs in our own agency can maybe help out to lower their expenses. So areas like the energy assistance program to help reduce their energy expenses, helping out with food expenses as well. So like helping them get signed up with EBT through our resource center, or the CSFP program that I'll let Lori talk a little bit more about. And then, yeah, getting them connected to different programs as well.
So that information and referral is a really important part of your work, and that is internal to community action programs, and then also externally to other agencies. So let's talk about specifically volunteer services, senior and disabled volunteer services. You have this program that does provide some direct services when you've got enough volunteers. So who qualifies? And then we'll go into the specific types of services that your volunteers provide.
Yeah, so in order to be eligible, a person has to be either a senior, so 60 years and older, or an adult, 18 years and older with a functional disability. They also have to be residing here in Skagit County and living at home. And what I mean by living at home is that they have to, so if they're living like in a residential facility or in an assisted living situation, then they wouldn't be eligible for our services. If a client is receiving assistance through like the COPES program, then we can only provide services with tasks that aren't being covered through that program. For financial eligibility, we're able to determine that through an assessment. But the main thing we look into is that they are financially unable to pay for assistance elsewhere.
So I did
Yeah.
show your webpage on there, and there's information about eligibility. And some community action programs actually, they put their income levels on their webpage, and you don't do that. And that's because you are kind of doing this holistic assessment because there's many things that might come into play. So would you say that there is no wrong referral? Like if some people don't have to screen themselves in or out of this program, you help with that, right?
Yeah, absolutely. And if they are people that can pay for those services, but they're just reaching out because they don't really know where to attain those services, then we can help them and give them suggestions where to look at as well.
So you mentioned that they have to be living at home, and that's really the goal of volunteer services, isn't it? Can you just tell us a little bit about that, the big picture mission of volunteer services?
Yeah, absolutely. So our main mission is to be able to provide assistance so that our seniors and adults with disabilities can continue to live independently in their home in a safe environment. And we're able to provide this assistance by mobilizing community members as volunteers out in our community to provide those direct services to our clients.
Okay, so volunteers, they're in the title of your program and you keep mentioning them. They're a really important part of this picture. So there's some things these volunteers can do or may do as a request from one of your client seniors. And there's other things that they can't do. Will you tell us a little bit about the can do and can't do lists?
Yeah, so some of the services that we can offer, depending on the kind of volunteers we have at the moment and also their availability, are services like providing transportation for clients to get to their, very needed medical appointments or other essential locations, running errands like grocery runs, taking clients to the bank or to pick up their prescriptions, yard care assistance, minor household repairs, helping with like moving items in their house to make it more accessible friendly. We can also assist with getting firewood to clients whose main source of heat is firewood. Housekeeping assistance, meal preparation, communication assistance, moving assistance, monitoring. Those are the main services that we can at times offer. Some of the things that we generally can't provide is like personal care unless we have a volunteer that's specifically licensed to be able to provide those services.
And you don't provide healthcare services. This is not licensed nursing care or in-home care in that way. It is actually, the program used to be called volunteer chore program, right? It is actual kind of tasks. And while personally, I don't like the word chore, there's a lot that volunteers get out of this and a lot that the seniors and adults with disabilities, the clients get out of this beyond just the tasks being done. Can you tell a little bit about the benefits to both volunteers and clients in having these services come to them?
Yeah, absolutely. For clients, they're able to get that assistance that they're needing, and also they're able to get, keep an eye on them too. A lot of times we have homebound clients, and that's their main contact for maybe the week or the month. So it's a good way to keep an eye on our clients as well. And then for volunteers, it's just a lot of them just want to be involved in the community, and it's a great way to get them involved and have them understand the needs in the county as well. And they just get a lot out of it too.
So they're building relationships,
Mhm.
and it's that social contact, which we know is an important part of health. It's an important part of being well, is not just having the errands run, but someone to chat with. It's not just about getting the housekeeping done when somebody might have a bad back or a physical limitation. That's great, but it's also about that visit. And we're going to hear more about that from both Nikki and Lori, about that important social connectedness for the folks that we serve and for the volunteers. I'm going to come back to how to contact programs at the end, because it's all in one place. Nikki, why don't you pick it up from there? Why don't we actually start with where we just left off with Mariana? What do you have a story to tell or anything to share about how important Medicaid transportation services for volunteers and for the clients they serve?
Absolutely. Launching off of what Mariana was saying, it's really the relationships that people benefit, both the volunteers and the clients. Like one that comes to mind specifically is for the past year and a half I had a volunteer who has reliably and consistently offered transportation services for a client to her dialysis appointments. And recently he's been unable to provide those said services because of jury duty, and I've been helping take her to them. Amazing person. I just love being able to meet our clients, and just hearing her regard and her concern for him, like when he's not there. She always talks about how she hopes that he can come back and how she always looks forward to her transportation services. And the same goes for him too. I always hear about, he always gives me updates on how she's doing, as Mariana was saying, because I'm unable to do those services most of the time because we are reliant, or we are operated mostly by volunteer services. So just being able to hear back and get that feedback on how our clients are doing, and just see them build lasting relationships. It's just really one of the heartwarming nature of my position, just being able to see people being people and neighbors helping neighbors. It's just really a beautiful, beautiful thing to see.
We love neighbors helping neighbors. That's the heart of community action, is the community helping the community. So what the heck is Medicaid transport? Mariana's program is for older adults and adults with disabilities. Medicaid transport may serve those folks, but it's a little bit broader too. So what is Medicaid transportation services?
Okay, so Medicaid transportation services, it's kind of in the title. So we offer transportation for Medicaid clients to and from non-emergency medical appointments, and unlike the Medicaid, or unlike the senior disabled volunteer services, our clientele are a bit more diverse in age. I've seen clients anywhere between toddlers all the way up to people who would qualify for Mariana's program. So it's very diverse. It just is reliant upon a person's insurance, and whether or not their insurance covers covers the transportation. And that is something that Northwest Regional Council, one of our partners, helps out with. If I get any need for transportation, my first go-to is to see if they are eligible, and in doing so, I would refer them to Northwest Regional Council, and Northwest Regional Council would then screen them to see if they're eligible for it. And if not, then I always have them come back to me, and then we can problem solve to see if there's anything else that we can do. Most often than not, there is a way.
So this is for folks who may not have their own transportation, or due to health reasons or age, they can't drive themselves. And for some reason, there's not a public transportation option for them. They've got Medicaid. And unlike Mariana's program, where people go straight to Mariana, folks, to get screened for Northwest Regional for Medicaid transportation, they go to Northwest Regional Council first. And what I'm hearing you say is, luckily, we don't have to remember all that to make a good referral. It's all on the web page. And there is no wrong call. If they call us first, you're going to get them to the right place. And if they don't qualify for Northwest Regional Council's services, they come back to you and you help with some problem solving and coaching on how to find those additional services. So that eligibility information is all right here. And is there anything you want people to know that you can't do, that Medicaid transportation or volunteers are not allowed to do?
So I do want people to know is that we are a volunteer-based service, so we can't always guarantee that the transportation will be offered just based upon volunteer availability. So that is one thing that it is a little bit of a hurdle sometimes, just making sure that we can offer that transportation. But again, Northwest Regional Council, they have a bunch of vendors. So if a client is eligible, they're most likely would be able to find a different service provider. So that I feel like that's pretty awesome. And in a good aspect, we are able to offer a little bit more broad services, broad in terms of location. So unlike Mariana's program that offers services specifically to people here in Skagit County, I do offer, or my program offers services in Skagit, Island, Whatcom, and Snohomish counties. So we have a little bit more of a larger clientele base, which I feel like is pretty cool and amazing for our neighbors. But yeah, with the exception of the availability, I feel like that's our biggest hurdle.
So you don't have hundreds or thousands of volunteers just roaming the streets like a Medicaid transportation Uber system where you can instantly deploy a volunteer driver. You're like dispatch in a way where you hear from Northwest Regional Council, we've got a client who needs to go to dialysis or cancer treatment or routine care, and you've got your pool of volunteers and you know what days and times they are available, and so you are the one who's like a matchmaker to get that volunteer connected to that client. Is that how it works?
Yes, that's exactly correct. Yeah, they make that phone call, and then from then on they get sent to the right person. So yeah, it's a fairly simple process. Just includes a lot of different connections, which I feel like is pretty cool.
Well, one other heart story I want to hear from you, I want our friends to hear from you, Nikki, is both seniors and disabled and Medicaid transport did some amazing things during the pandemic and during lockdown. And you had some volunteers. We had to discontinue a lot of volunteerism at Community Action. I see Tracy, our volunteer coordinator there. She knows this well because we're rebuilding. Medicaid transport was one of the few programs that continued to engage volunteers because it was so mission critical. It was life-saving work that these volunteers were doing. Can you say a little bit about how our staff and our volunteers ensured safety for themselves and for clients they were transporting?
Yes. So unfortunately, I wasn't here during the true lockdown of COVID. But from what I've heard from Robert McCracken and my other volunteers is that they were very rigorously following COVID precautions and cleaning their vehicles and wearing masks and wearing gloves and doing everything that the volunteers specifically were doing, everything that they could maintain safety for their clients. Because again, it is about the relationships. It is about caring for people. So that's really at the heart of most of my volunteers, if not all of my volunteers' core, is just making sure that they have safe and reliable, consistent transportation to their well-needed appointments. So it was just really just their dedication to the cause is what really shone through, especially during COVID. And I know, speaking from my personal experiences, I would never want to go out and do additional work. So just truly, my volunteers are just amazing people, and they really care about the agency, they care about this community, they care about the clients that they serve. So it just really, they shone like superstars, and I'm forever grateful for the work that they've done.
Thanks, Nikki. We're going to go to Lori next, and I know she's got some superstars as well. And as a reminder for our friends and guests today, all of this information on Senior and Disabled Volunteer Services Program, Medicaid transportation and commodity supplemental food program are on the Community Action website. And included is a little bit of eligibility information and how to get connected. And on that page, there's even a form where you can easily just say, hey, I want to learn more about this awesome food box program. Tell me more. Whether you are a senior who would like to get a food box, or you're working with one, or have a friend or family member who might benefit from that. So Lori, why don't you tell us what the heck is this food box program? Introduce yourself and where you are and what your program is.
Hi, I'm Lori Burgerstock, and my program is the Commodity Supplemental Food Program. We just shorten it to CSFP. It's a lot easier to say. And I'm in the Food Distribution Center in Cedar Woolley.
And Lori, tell us a little bit about who qualifies, and then we'll get to what do they get. So who qualifies for this monthly food box?
Well, anybody that is 60 years of age or older, and we also have an income guideline, so they can't have more than $1,473 for one person coming in a month. And most of our seniors that are on the program make way less than that. I mean, it's awful at times to hear the amount of money that these people are living on. It just breaks my heart. I've developed a lot of relationships over the pandemic with being at home with the seniors, and just talking to them to make their lives a little bit better. It might have been the only time they heard from somebody the whole month. And
So
with our volunteers.
How many seniors can you serve a month? How many seniors, what's the maximum number that your program can serve?
Well, right now it's 200. We've had a drop in people that have signed up for the program. Altogether, I have served over 700 seniors in the 6 years that I've been doing the program.
So you do have openings now. So one of the things, obviously, what you can do at the end of this Brunch and Learn, there's going to be a request for volunteers. That's no secret. We're very transparent about that. But one of the other asks is for referrals. And so right now, anyone on this call could help a lower income senior, age 60 or older, to sign up for Lori's program by going to that link that we put in the chat. And Lori, you call them, you enroll them in the program, you provide more than that because you're that connection. But what does the senior actually receive at their doorstep? How does that work?
Well, we have a 30-pound box of food, and we have a box building party every month where we have seniors that are volunteers that come in and build the boxes. And so they have cereal and milk in cartons that doesn't have to be refrigerated till you open it. It's all shelf stable food, except for the cheese, but we're out of cheese. Yay. No. Finally. We also have just introduced a produce box. So that is 15 pounds of produce, and the seniors are they can't thank us enough for doing that, because fresh fruits and vegetables at this time of year is going to be very hard for them to, they can't afford all of that, and they may not qualify for very much food stamps a month. So a lot of our seniors, before pandemic, we're only getting like $14 or $16 worth of food on food stamps at EBT. And so they relied on this box of food every month, because that may be some of the food that they only have at the end of the month is our box, because they don't have any more food stamps, they don't have any more money, and they don't have any way to go to the store.
So those food boxes come later in the month, right?
Well, they come, we have scheduled deliveries, so, and it's all volunteer based, and we have some awesome volunteers, and we have several routes a month. We serve all the way up to East County and Anacortes, Mount Vernon. We've also done Big Lake at times. We've gone almost up to Alger. We go La Conner as well. We have like 14 routes that we do each month. So I coordinate and make sure that people get on the routes so they get their food box. And so it's counted. Each route has a certain amount of people on it and location wise.
So
Yep, there we are.
You mentioned the Skagit Food Distribution Center, and this is in Cedro-Woolley. So this is a direct service program. The food box program is a direct service program, but it's based at one of the capacity building projects that Community Action has done for all of our partners. So the Food Distribution Center gets big loads of food in on semis and then redistributes that food to partners at the 19 food banks and feeding programs in the county, including the food box program. And so most of the food going in and out of food banks to food bank families goes in and out of the food distribution center first. So this is where you are right now. We see that background. You're in the office there.
Yep.
Greetings from Cedro-Woolley.
Yeah.
And so when you have your volunteers, you have some volunteers come and build the boxes, and then you have other volunteers that drive something like that box truck there. One volunteer drives the truck and the other volunteer jumps in and out and delivers the food boxes.
No, they both deliver at times.
They both do. Good.
Unless they have restrictions. And the other person is also doing paperwork and getting it organized, making sure they're making the deliveries that are on the list. And the seniors look forward to the volunteers coming, and they also question when they don't have their regular volunteers. There's times, and I've had requests for certain volunteers. We had a really nice looking young man, and all the ladies were asking for him to deliver the food boxes. It was cute.
I do want to go back to one of the things that you brought up, and that is the importance of nutritious fruits and vegetables, produce.
Yes.
And one of the reasons that we're able to include additional produce, fresh food, in addition to the 30-pound shelf-stable box, is because our food distribution center works with local farmers and contracts to grow local fruits and vegetables. And then because of that purchasing program, those farmers know about us and they're so generous, they end up donating more food than we even purchase from them. So I just want to do a shout out to the farmers of Skagit County, because they are helping to keep our lower income seniors healthy and stable. So let's do a woohoo for local agriculture. And the Food Distribution Center for making that happen, and Lori for coordinating the volunteers.
Tracy too.
Well, oh yes, we can't forget Tracy. Tracy Monteron, will you please introduce yourself, our agency volunteer coordinator and also a coordinator out at the Food Distribution Center.
Yeah, hi, that's me, Tracy, volunteer coordinator. And if you know anyone that's interested in helping out in any of these programs, you can email us at volunteercenter@communityaction.org, and I'll get back to you and talk about what your availability is and what program might fit in with your schedule. So we'd love to hear from you.
I knew that Tracy would come in with the punchline for us. Thank you, Tracy. We'll be mentioning it again. At the Community Action website, if you go to How Can I Help, you can click on Volunteering with Community Action and get Tracy's contact information, and also see all of the volunteer opportunities with Mariana's program and with Nikki's program and with Lori's program. And in addition to all of that, Tracy coordinates the Skagit Volunteer Center for all of our partner agencies. So if you work with a nonprofit or a government agency who could use volunteers, make sure you're listing yourself on the Skagit Volunteer Center website, whether you serve seniors or others in the community. And this is an example of how Community Action has all of our volunteer opportunities right there listed. So we are actually going to do one of these brunch and learns specifically on the Volunteer Center in 2023. But we wanted to make sure that you all knew it was an easy way to connect with Tracy, get your church group or your Rotary Club, your business connected and have a fun day building boxes at the food distribution center or delivering a food box or driving somebody for the Medicaid transportation program. So I'm going to ask one more time, did Robert McCracken join us today? I don't see his name on the list, but he might be in incognito. Robert, are you with us today? Well, I'm going to ask Sandy and Bill, my boss, our executive director. Sandy is a division director and Bill's our executive director. Can you just tell us, you know, two or 3 minutes most, the impact of Robert on these programs and what he's done? He retired recently.
Robert was, he had a great impact on the program. And I think more than anything, it's because he had so much heart in it and he was just so committed to service and to serving the community. And when he tells stories about working with clients and volunteers, of course, just a big smile comes to his face, and he loves to, you know, to share funny stories or experiences, and just knowing that the time and the energy and the heart that he put into his work was truly amazing. And he was with Community Action as an employee, I believe, for 22 years, and even prior to that, as a volunteer. That was his service has been truly amazing. So it was great to wish him on his way when he was ready for retirement, but I know it's tough for him to say goodbye because he is so committed to the work, especially serving seniors and people with disabilities in this county. So Bill might want to say a few words too. Thanks.
I think Sandy nailed it. Robert is and was a saint, and he didn't want to do anything but serve seniors and people with disabilities. That's what he wanted to spend his waking moments doing, and he did it. And if you ever run into Robert McCracken, just ask him to tell you a story. Just say, hey, Robert, can you tell me a story? And then I can guarantee it will be time well spent listening to it.
Robert lives in Anacortes, and we're lucky that we will get to see him. We're asking him to take some time off, well-deserved retirement, but he keeps threatening to come back and volunteer with us again, which is wonderful. So we do want to end today with some questions and answers for the group, but of course, each of these Brunch and Learns ends with our requests for you, for our neighbors, Community Action staff, our partners. And today, number one is referrals. So again, I'll ask Isabella to put the URL in the chat again of how to access these programs for seniors and adults with disabilities and Medicaid patients. So referrals are number one. And then the next is volunteers. Reach out to us if you have a church newsletter that you edit, or you are the service chair of a club. We'd love to come and talk with your group about how they could get involved with these or other programs. In particular, we're looking for volunteers to serve seniors in East County. Our Concrete Community Center and East County Resource Center are helping us to recruit volunteers to provide these needed services, so those lower income seniors in rural and isolated places also can live independently at home. We're especially in need of volunteers who are willing to do light housework. I know that I avoid doing this for my own home, but doing it for someone else for a couple of hours is a gift. We also are in need of Spanish-speaking volunteers. Increasingly, we're getting requests for clients who are most comfortable in Spanish. And Mariana, can you give just an example or two of some of the client needs that you've heard from the Spanish-speaking community?
Yeah, well, actually, just recently, we had somebody reach out who only spoke Spanish. Their caregiver was going to be out on vacation. So I was able to communicate with her. So also just to let people know, for referrals and people that speak Spanish, I am bilingual, so I would be able to speak with them too. So feel free to, for Spanish speaking clients, to send them my way as well. I got her connected with a volunteer who just only spoke English, and I worked it out and things like that. But the volunteer, so I was like, man, I wish I hadn't taken, I think it was German, like I wish I had done Spanish, so I could have, been able to connect with her more. And the senior also was just would have, I think, felt more comfortable for sure if they had been able to have that connection. So while it's doable, I think it's really important for there to be a shared language.
And let me ask Mariana, Lori, Nikki, or Tracy, are there age restrictions or anything else that we should know about who can and cannot volunteer?
Yes, I know for my program, at least, we try to have our volunteers be at least 18 and over, they need to be legally able to drive. So, but yeah, we're looking for at least adults to offer the transportation services, especially just because of the nature of the Medicaid transport business.
Mariana, do you have age restrictions or anything like that?
Yes, so I would say, especially for transportation, I would just emphasize what Nikki said. And then if it's underneath 18, 16, they would just need, I think, parental consent. But we would be able to find some things.
Maybe if they were students learning Spanish, older teens, or students in college classes would be eligible.
Yeah.
And we can sometimes use older teens out at the distribution center warehouse, 16 and over.
16 and over.
And then, of course, to drive clients, we want people with a clean driving record.
And one thing I'll mention is that Community Action of Skagit County, we encourage everyone in our community to volunteer. Every person in Skagit County has smarts, talents, and experience to contribute to their community, including people with adjudications. We do conduct background checks on all of our volunteers, and we place volunteers where it's most appropriate. So in the programs that you've been hearing about, we would not place somebody who had something on their record if it was something that had to do with harming a child or a vulnerable adult. Obviously, we can't have people driving if they've got recent DUIs on their record, things along those lines. However, our awesome volunteer coordinator, Tracy, works with folks to find appropriate placements, either at Community Action or another agency, because everyone deserves meaningful service and everyone has something to contribute. So there may be some restrictions on who can and cannot volunteer with these programs, but there's no wrong referral to the volunteer center because Tracy is able to do information and referral to other programs as well. So at this point, I know that we've got a bunch of partners and staff who may have questions. So please just wave, take yourself off mute, or raise your Zoom virtual hand, and we'd love to hear questions for our team.
Oh, it looks like Kimberly has a question in the chat, and maybe Tracy or Liz could answer this one. It's specific to volunteer hours.
Okay, so it says, I'm new to Washington, so not sure the school systems. Is there a high school requirement for X number of hours volunteerism for graduation? And if yes, is Community Action Skagit connected with the local schools? Tracy, do you want to speak to that?
Sure, a number of our local school districts do require some volunteer hours. Some even offer a varsity in volunteering. They can letter in volunteerism, which is pretty cool. We do have a little bit of participation from high school teens, but with a lot of our programs, the issue is they happen during the school day. So a lot of times I end up referring students to organizations that have things happening in the evenings or weekends that work better with their schedule.
And Community Action did work with the United Way and United General to start that varsity and volunteerism program. And the Volunteer Center and Community Action were partners in that. I believe it's in 3 or 4 of the school districts now. And in particular, rural and isolated students in East County and lower income students, it's very challenging for them to do those volunteer requirements because some students have jobs. As Tracy said, they're going to school during the day. They might have jobs after school. They might not have transportation. So one of the things that we've done is to create projects that students can do on site. So there's a number of examples of this, of doing donation drives, putting together care kits for neighbors without homes, things along those lines. So if you're working with students who have a question like that, feel free to reach out to Tracy. And if it's not something that we can do, again, she'll refer folks out to other agencies. Lindsay, introduce yourself and what question do you have for the team?
Yeah, thank you. I work with Skagit Regional Health as well as Kim, and I'm also a patient navigator. And I had a question for Nikki about the Medicaid transportation program. I know you were saying that you are able to work with a few different counties, but I have some clients who may need assistance with cross-county travel, such as like from Whatcom to Skagit for non-emergency medical appointments. So I was wondering if that is something that might be applicable for your program as well.
Yeah, so it definitely is a possibility, but again, it's all reliant upon our volunteers' availability. One thing I didn't mention in my presentation part is that we offer 2 different types of services: ambulatory, which is where the volunteers get to really help out and shine, and then wheelchair, which is my segment of it. So we offer wheelchair services for people all over the nearby area, and I get to be a little bit more broad with it. So yeah, it just depends on the availability, and it depends on if they're eligible for either Mariana's program in Northwest Regional Council, if it's a wheelchair service, or if they're eligible for Northwest Regional Council for an ambulatory service. So the eligibility kind of varies for those 2 different forms. So just if you have any specific questions, please feel free to contact me, and I'll be more than happy to problem solve.
So Lindsay, no wrong call to that 7585 number, no wrong call if you want to chat with one of our staffers and do a little problem solving around a patient need. Also, Northwest Regional Council, the area agency on aging, as Nikki said, contracts with multiple vendors, agencies like ours. So they might have a volunteer in Whatcom County that might be more suitable or have a different schedule. So also, if that patient has Medicaid, no wrong call to Northwest Regional Council. So either reach out to us and our folks will screen to see if they can help, or reach out through Northwest Regional Council and someone will try to get that patient hooked up.
Thank you.
Thank you. I do want to just mention that we got a message that Robert McCracken, our friend, found out that he had to take his daughter to Bellingham for a final exam. That's why he wasn't able to join us today. So just wanted to do a shout out to Robert and attending to his family. There's a question, Diana P. Nikki, does your program have a wheelchair accessible vehicle?
Yes, we do, and it's on the website. It's a big red van we covered. That's where I do all my wheelchair services. You can see me showcase with slightly different hair. And yeah, so we offer services throughout the different area. And again, I have gone all the way down to Coopville, and I'm based in Burlington, my office is. So yeah, we do long trips, we do short trips, whatever a client needs, I'm more than willing to accommodate to, so long as my schedule is available. But it almost always is.
this is probably a good transition back to Sandy. We got plans, man. What's going on? What's the future look like for these awesome programs?
Oh, yeah. Well, I think the future looks awesome. We know that we've got a lot of seniors that we're already serving that we want to make sure know about and have access to a lot of the other resources that we have available. So we're looking at making sure we're doing a very holistic messaging and making sure that seniors have all the information they need to make sure that they can stay living independently, and to make sure that we're addressing those social determinants of health and providing services that will help them maintain their physical and mental health as well. So in terms of looking forward, we've mentioned East County a couple times. I know that Mariana and Nikki have been working with our East County staff to, one, identify seniors that need some support and some help, and also to be able to recruit volunteers, because we're not going to be able to reach more folks if we don't have the volunteers to be able to reach them. The same goes for looking at Anacortes, and just like East County, Anacortes has a higher number of seniors than the rest of the county on average. And so as we're looking at expanding our services to Anacortes, we want to make sure that we can again address the folks that we're already serving there and make sure they know about the opportunities for expanding their income and making sure that they can access services that they are eligible for, but also that we need to have volunteers to make sure that we're reaching out and reaching seniors and people living with disabilities that we haven't yet been able to reach yet. So those are a couple of the areas that we're looking at expanding. That's what's in our future. I'm happy to answer questions about that if anybody has them.
Is it improper for me to ask about a certain grant with a certain state transportation department?
Oh no, we put in a request to be for a WASDOT grant to be able to increase our fleet of vehicles. Part of which the goal would be to be reaching for our senior and disabled volunteer services to be reaching out and doing more home visits and being able to reach more seniors and people with disabilities, and more opportunities to be able to provide those services. So fingers crossed that will come through. That will allow us to be able to meet people where they're at, to be able to provide more services. And have more cars available to not only run errands, but also drive people to appointments and other things. So, yeah, we'll find out about that in late spring.
Everyone,
fingers crossed.
It's for the community. It's for our seniors. Well, that also reminds me, Sandy, that I should be asking our staff. So volunteers may drive an agency vehicle if it's available. For some of these programs, volunteers may drive their own vehicles. Can someone tell us what's in it for the volunteer? Are we asking them to pony up with high gas prices and fill their tanks with gas and just be giving it all away? Or are volunteers are volunteering their time? What else is in it for them?
Yes, so there is a mileage reimbursement of, I believe, 62.5 cents per mile. So volunteers have the opportunity to either select that reimbursement or to opt out, depending on if they want to provide an in-kind donation or if they're wanting to get that reimbursement.
And I just want to say a huge thank you to Community Action's leadership, because the IRS still puts a volunteer mileage reimbursement at 19 cents a mile. And Community Action committed, because we're an anti-poverty organization, our volunteers shouldn't be putting themselves further into poverty to serve their neighbors. And so thank you to our finance team and to the agency leadership and our board for raising that mileage reimbursement and making it easier for people to say yes to volunteering. Volunteers are covered under Community Action's insurance, and we can talk more about all of that if somebody's interested in volunteering. So we do have like 2 more minutes left. Any other quick questions for this Rockstar team? Well, we didn't have time to go deeply into it, but Mariana, Nikki, or Lori, can you just end by saying why you do this work? Can you share a little bit about your own path and what this kind of work means to you?
Yeah, I mean, I'd be more than happy to share. Oh, sorry, you can go.
Go for it, Nikki.
Okay, yeah, so I spent years working with seniors in retirement homes. So that's what really sparked my interest with working with this population. And I get to do a great deal of it in my current position. So just being able to meet new people and just learn their life experiences and just hear their story, it really just brightens my day, and just being able to just have those interactions and just know that what I'm doing helps the community. It's a fulfilling work, and it's not about the money for me. It's about being able to help my neighbors and just get to just really fulfill my goals in that sort of sense.
Well, thank you for that, because one of our goals with these Brunch and Learns is that our own staff and our partners know that there are friendly people behind the phone numbers and the websites, and that they really care about the people that you all are serving. So let's give it up for Nikki and Mariana, Lori, Tracy, and everybody at Community Action who makes this work possible, and all of the partners, because we can't do it alone. Thank you all, and we'll see you in 2023.